Why are tiny cuts used in diverticulitis surgery? Imagine a surgery that's less invasive but just as effective. That's what tiny cuts, used in laparoscopic surgery, bring to the table for treating diverticulitis. Instead of one large incision, surgeons make 3 to 5 small cuts in the abdomen, each less than 1 centimeter long. These tiny openings allow the surgeon to insert a slender tube called a laparoscope, which has a camera and light attached. The camera sends real-time images to a monitor, giving the surgeon a clear view inside the abdomen without needing to open it up completely. The main reason for using these small cuts is to reduce pain after surgery. Larger incisions tend to cause more trauma to the muscles and tissues, leading to increased discomfort. Smaller cuts mean less damage, so patients often experience less pain and can move around sooner. This also translates to a quicker recovery, shorter hospital stays, and a faster return to daily activities. Another advantage is the lower risk of infection. Smaller wounds are less prone to bacteria entering and causing infections. Plus, these tiny scars are much less noticeable, which many patients appreciate for cosmetic reasons. Studies have shown that laparoscopic procedures tend to have fewer complications, such as wound infections, hernias, or excessive blood loss, compared to traditional open surgery. In cases of diverticulitis, the surgeon usually performs a sigmoid resection, removing the part of the colon affected by inflammation or infection. They then reconnect the healthy ends of the colon, a process called anastomosis. When the disease is not too severe and the patient's condition is stable, this can often be done safely through small cuts. However, if there is severe infection, abscess, or an emergency situation, open surgery with a larger incision might be necessary to better control the infection and remove infected tissue. Using tiny cuts in diverticulitis surgery helps lessen the stress on the body, which can reduce the chance of complications and support a smoother recovery. This approach is especially helpful for people who have had repeated flare-ups or those with higher risks due to age or other health issues. Overall, tiny cuts in laparoscopic surgery make the procedure safer, less painful, and easier to recover from, while still effectively treating the disease. Always consult with your healthcare provider to determine the best surgical plan tailored to your individual needs.